So as a medical officer for the RFDS, we do a range of things. The majority of my work at the Kalgoorlie base is involved with emergency retrievals of patients, either from primary locations, which is outside of hospital, nursing posts or things like that, and then retrieving them to get medical care in hospital. And the second aspect of that is inter-hospital transfer from Kalgoorlie or other hospitals around, transferring them to Perth for tertiary level care. The other aspect of our work is we do a fair bit of telehealth consults, so over the phone. We do have over 100 RFDS medical chests spread around Western Australia, and we run the telehealth service for those patients. Sometimes they're emergencies, sometimes these are consults that can be managed as outpatients in the community, and we use the RFDS chest to start the management until they can get to see a doctor. The other aspect of my work is also doing the RFDS fly-in, fly-out clinics. So about once a week or twice a week, depending on the schedule of the clinics, we at RFDS Kalgoorlie base we would run a fly-in, fly-out clinic. There are multiple communities around that don't have access to medical care or primary health care, and we do visit them once a month at least, sometimes more often if there's a need to, and we provide them with primary health care, GP services, routine chronic disease management, and that's divided between all the medical officers at the RFDS Kalgoorlie base. I think the most rewarding part of my role is when you know that I've spent the majority of my career working in rural Australia, and I'm well aware of the challenges that people face in country Australia, whether it's interstate or in Western Australia. And I think the most rewarding part is when you get a phone call, you have to put yourself in those patients' shoes, and having lived in rural Victoria, I know what it means to not have resources around. I know what it means not to have a doctor on site, or sometimes not even a remote area nurse on site, and you have to manage them on the phone with whatever resources they have from the medical chest or around them. And I think at the end of the day, when you retrieve those patients, or even if you provide primary health care to those patients, and they get better and you see them again, and they tell you that they've recovered from whatever illness they had, I think that's probably the most rewarding part of the job, knowing that it doesn't matter where they are in Western Australia, we've been able to make a difference to their healthcare that I think we should be proud of as an organisation.